Welcome, everyone. I think I'm expecting another 10 or so to be coming into the waiting room. Become accustomed to Zoom. Sorry, I'm just trying to, the meeting room function is newer to me. So I am just letting everyone in as we go. Hi, lots of familiar faces, lots of new faces. Thank you so much for joining us. My name is Amy Cunningham. I'm the Deputy Director of the Vermont Arts Council. And the Vermont Arts Council is the Vermont State Arts Agency. And we've been supporting arts and cultural organizations across the state as they respond to this immediate COVID-19 crisis in communities throughout the state. And public health experts are still learning about this disease. Much is still unknown, but it's clear that we need an informed, science-based approach as Vermont's cultural organizations plan for the future. So we've invited Dr. Patsy Kelso, the state epidemiologist for infectious diseases at the Vermont Department of Health, to offer her expertise and respond to your questions. Just a few items of housekeeping. Just a quick thumbs up that you all can hear me. You hear me? Excellent. Thank you. This is being recorded. So if you have colleagues who you'd like to listen in to this, we'll be posting this on our website later this week. And I also mentioned that in the case of any breakup or disruption in your internet access, that this will be available to listen to afterwards. I'm happy to be joined by my new colleague, Catherine Crawley, who's our Director of Communications, and she's available. If you run into any tech issues, you can chat with her directly. I think we've all been taking crash courses in Zoom this last month or so. And so I'll ask for your patience. We've been doing lots of Zoom meetings. This is the first one that I've moderated that's quite this large. So I'll just ask in advance for your patience as we get to everyone's questions. For efficiency's sake, we've got many of you submitted questions in advance. Thank you. And that's gonna form the beginning of the conversation. And then as you are so compelled, feel free to use that chat box function to chime in with other questions, which I will be paying close attention to and pitching to Dr. Kelso. And I'll also say that this is a really complex situation, and it's a rapidly changing situation. And so we're really committed to connecting you with the expertise you need to make informed decisions. And so we're happy at the Arts Council to continue to compile your questions and issues and get them to the Department of Health so that we can share out with folks. So I see this, I guess, as the beginning of a continuing conversation with our public health officials. So with that said, it looks like we've got about 56 people here, and I'm just going to open up great. So welcome, Dr. Kelso. Thank you. We're joined by 60 representatives of arts and cultural organizations, large and small, from communities around the state. Dr. Kelso, we're all thinking about about what the future might look like when we reach the point where Vermont begins to safely reopen businesses and ease restrictions on public gatherings. The health and safety of our artists, as well as all Vermonters who enjoy attending performances and visiting museums, attending classes, engaging in the arts, are of course of primary importance to us during this crisis. We know that arts and cultural organizations are places where people will want to come back together as our towns and businesses reopen. And we also understand the need to put safeguards in place to protect public health. So with all that said, what can you tell us about what the future might look like for Vermont communities as we start to, I like the governor's metaphor of turning the spigot slowly back open?
Yeah, it's a great question. Thanks for having me. I appreciate the opportunity to talk to so many of you at once. And unfortunately, we can't predict what the future will hold, but we will continue to assess summer and fall activities and communicate updates and changes as the situation evolves. And it does change day to day and certainly week to week. What the gradual reopening will look like is not yet fully clear, but it will likely mean that summer and fall group activities may not look like they did before. We put many steps in place in Vermont as we began our COVID-19 response in early February of this year. And we will be able to relax some of those strategies in the days and weeks ahead, but many strategies will likely remain in place, including cloth masks in public. Outdoor events, where possible, may generally be preferred over indoor events. The size of group gatherings will continue to be restricted. Partial occupancy may be required for events and programs to allow for social distancing. Stay home when sick policies will be strongly recommended, as they always have been, but even more emphasis on that. And we know that temperature checks are not sensitive for identifying all cases, and we don't know yet whether they will be recommended. So we'll continue to monitor the scope of illness in Vermont and test people for COVID-19 to identify any rise in cases during the recovery/reopening. And our main focus at the health department will remain on protecting the health and well-being of all citizens, with a special focus on ensuring health among those at higher risk, especially people who are older. We will continue testing and contact tracing, so that means finding every new case and minimizing the spread by reaching out to their close contacts to inform them that they've been in contact with a case and they should quarantine for 14 days. And that way, that's what we've been doing all along to minimize the spread, along with social distancing and these other measures. So we'll continue to do that. And if you have questions now, I'm happy to try and answer them to the best that we can right now.
Thank you, Patsy. And again, I'll encourage anyone to use the chat function to ask some specific questions, but I'll refer now to some of the questions that some of you submitted in advance. And Patsy, we had a number of questions that were focused around protocols for sanitizing objects, having in mind libraries, thinking of hands-on interactives in museums. What kind of protocols do you think might be in place for cleaning before reopening, and then regular cleaning protocols?
CDC on its website, cdc.gov, has some really good, useful, straightforward messages about cleaning and disinfecting. So cleaning is when something is visibly dirty, and then disinfecting is sanitizing, getting rid of germs. So if something is visibly dirty, you would want to clean it first and then sanitize it. If it's, pretty clean and you're just trying to get rid of germs, you can just do wiping down with appropriate products depending on what you're wiping. All of that information is available on CDC's website. There's a really straightforward page about that. I think we have to use common sense as much as science a lot of the time, and we're never going to be able to stop touching things. We don't want to stop touching things. So it's important to keep in mind, while social distancing is going to be key and a cloth facial covering is going to be key for source control, because we know the virus can be transmitted before someone has symptoms, or even if they never develop symptoms. So the cloth mask keeps your own droplets in and prevents you from spreading them to other people when you're simply talking or clearing your throat, or if you do cough or sneeze. So those things remain important. but we're still going to be out interacting with other people in limited ways and with the environment. So the basic things about hand hygiene are going to continue to be important. Not everything in the environment, books, for example, you can't sanitize them. So we are going to be touching things. So frequent hand hygiene and then avoiding touching our face, because if we have the virus on our hands and then we touch our face, it can be transferred to a mucous membrane, and that's how we can get sick. So keeping in mind cleaning and sanitizing when we can, but we're not going to be able to stop touching things. The other thing is we don't know everything about this virus because it's only been known to us for a few months, but we think it can last in the environment on surfaces for hours to days. It doesn't last for weeks. So if you have a building that's been closed for 2 weeks or a month, basic cleaning is appropriate, but you don't have to worry about sanitizing everything in there if a building has been closed. Depending on the surface, if it's a cloth surface or paper or steel, the virus can last for different periods of time, but generally it's hours to a couple days, not weeks.
Great, that's very helpful, and that does address several of the questions and concerns that in particular some museums and libraries had. So I'm going to move, we've got some questions in the chat that align closely with some of these that were submitted in advance. And thinking about the staging of increasing allowable group sizes. And in particular, we've got some folks who are trying to make plans for potential summer camps or summer group activities.
Yeah, it's hard to say right now, unfortunately. I think we need to pay close attention to the governor's press conferences. He has been doing those Mondays, Wednesdays, and Fridays at 11. This past Friday, he announced a bit of opening up on restrictions for some workplace sectors. So I think we need to follow his lead. He's speaking with my commissioner and myself and other experts to make informed decisions based on where we are in the course of the outbreak and what our new case counts look like and things like that. So, I can't get ahead of anything. I would say stay tuned to those at least on a weekly basis, because things may change, from week to week. And then the Agency of Commerce and Community Development website should have the latest information on as things are opened up again. Things should be posted on that website, and it's accd.vermont.gov.
Thank you. Picking back up, excuse me, on what you said earlier about the notion of outdoor events being okayed before some larger indoor gatherings are okayed. Just if you could talk a little bit more about that, we've allowable group size and how these organizations might begin to think about sizes and whether things are indoor or outdoor.
Yeah, again, it's too early to really answer those questions. We're thinking that outdoor is preferable to indoor just because you can do more social distancing typically outdoors. But cloth masks, I think, are going to continue to be strongly recommended at the least, whether something is happening indoor or outdoor. But just social distancing, it's really impossible to say you can have 10 people or 30 people or 4 people at this point.
We just don't know yet. And so
we just don't know. We use the guideline of 6 feet away being social distancing in the context of this virus, but so that's a general guideline. If you need to start thinking about, how many people you could fit in a certain room, if you needed people to be at least 6 feet apart, but that's not a statement that you can start holding those events at this point.
And just to reiterate your point, Dr. Kelso, of the governor's, those Monday, Wednesday, Friday updates at 11, that's the best place to get the most breaking news on the new policy recommendations, right?
Yes, and the new policy recommendations are posted pretty quickly on the ACCD website.
Yeah.
So if you don't have a chance to watch the press briefing live at 11 on a Friday, for example, you can either watch a recording of it later in the day, or you can just check out that website.
Yeah. And I'll just acknowledge the difficulty that this sector, along with other sectors, has in needing right now to make plans for events that are happening in 3 or 4 and 5 months, and there's just so many unknowns. So we're all grappling with those unknowns that affect us in all different ways. Picking up on, and again, I know we don't know what exactly is going to be recommended and what the stages might look like, but the thoughts about the makeup of audiences and thinking in particular of some organizations who are doing programming with particularly vulnerable populations, and whether those might be phased in or come later, or what kind of considerations might be in place for those.
Yeah, I think, I hate to say this every time, but it's too early to say. But we do know that elderly populations are more vulnerable, so it's important to keep that in mind as you're planning. There may be some recommendation, I don't know, but there may be a recommendation not to have those events, or there may just be a hesitation on the part of participants to engage in those types of group events.
So I have an interesting specific question. Excuse me. I have a frog in my throat. From the Vermont Jazz Center, and I'll just say for housekeeping, if anybody wants to, these questions are coming in and they're great. If you're wanting to ask a question anonymously, feel free to just send it to me privately as opposed to the whole chat. But here's a question from Rob at the Vermont Jazz Center. They're looking into live streaming their concerts. A lot of folks are looking into interesting live streaming options. And he's wondering whether we could consider having a 5-piece ensemble perform on their stage in a month with only a sound technician and a videographer present. So that's 7 people in a room a month from now.
I can't answer that. In general, I don't know the size of the room, but if it's possible to have the musicians spaced far away from each other, if some of them obviously wouldn't be able to wear a mask depending on what instrument they're playing, but if others could, I think that would be recommended. It's something that may be feasible in a month or so. I can't give a blessing for it at this point.
And thank you. We understand we're putting you on the spot, and I know that so many of these answers are we don't know yet, but to hear a public health expert say we don't know yet is helpful. So we appreciate that. A question around, given that many of us rely on audiences from both within and outside of Vermont, what's the latest on the 2-week quarantine for out-of-towners, and what do you think the state might be looking for as they start to consider turning the spigot back on that?
That's not something I can speak to. That's a policy more at the governor's office level and with other state agencies, informed by the health department, but not determined by the health department. So again, ACCD website or other state agency websites may have information on that.
That 2-week quarantine for out-of-staters, it remains in place currently, correct?
To my knowledge, yes.
Some interesting questions about workspaces. As we start to think about actually coming back into workspaces, Someone said, so much for our beloved cubicle farms and open offices. Should we start to be thinking about reorganizing workspaces so that there's at least 6 feet of space between colleagues?
Yeah, it's not a bad idea. You know, the health department is 100% virtual at this point. There are a few staff in the building to get faxes and things like that, but it's definitely too early to start thinking about a normal workplace environment with people gathering in any sector. So social distancing where workspaces do need people present in person. And you know, that 6-foot distance, it's somewhat arbitrary based on how droplet transmission happens. When we think about diseases that are spread by an airborne route, which is measles and tuberculosis, for example, those are in fine aerosolized particles that we cough up and breathe out when we sing or clear our throat. And those can spread much further, and they can linger in the air, suspended in the air for hours, and you know, hours typically. Droplets, on the other hand, are bigger, moist particles that we exhale, and those typically, because they're bigger, they only go out a certain distance when you cough or sneeze, and then they fall to the ground. So, you know, 6 feet is not an absolute cutoff. It might be with a strong cough or sneeze, it may be more like 8 or 10 feet, but generally 6 feet is about as far as those droplets go before they just drop to the ground. And that's why, and so they don't like hang in the air suspended for a long period of time. So that's why we use that guideline based on the transmission, how this virus is transmitted through droplets.
And it sounds as though once it is reasonable to consider convening again in some sort of workplace situation, that requiring cloth masks for employees might be a very important protocol.
It might indeed be, yeah.
Okay. Let's see here. Lots of good questions. Couple of questions from our friends at UVM in different capacities, and wondering whether you see perhaps a university being in a different category with its own guidelines because of a student population living on campus.
You know, there are so many different settings like that, whether it's summer camps or college dorms or office work settings with cubicle environments, and you know, different people in those different settings are in different risk categories as well. So you know, it's really hard to say. At this point, we're not thinking that the dorm life is likely to resume next week or the week after, but you know, we'll see where the data leads us with our case counts and our infection rates and our percent decrease over from one day to the next. And, you know, that's the type of information we're looking at to help guide those decisions.
Thank you. And I'm just scanning through. I think that we have covered so many of these questions that are along these lines. I am seeing, so I wonder what we know yet, and I'm woefully ill-informed here, but there's talk about the notion of antibody and COVID testing down the road as a way to start having people know that they're safe to be out in public. What can you tell us about that possibility?
Yeah, we had a great working group last week from the health department and laboratory scientists and clinicians and people who specialize in ethics at the University of Vermont. And that was the basis for Dr. Levine, the commissioner's statements at last Friday's press conference. Basically, those serologic tests that look for antibodies, so it's a blood test that looks for antibodies, and that can tell if you've had exposure to this particular virus in the past or not. But there are a lot of things that those tests don't tell us. There are different types of antibodies. There's IgM antibodies that typically come up within a few days of you experiencing a new pathogen, and then there's IgG antibodies, which appear later in the blood and typically last a long time. The IgM ones that come up quickly don't last very long. So the IgG ones are more important for immunity. Those are the types of antibodies that you get when you have an illness like chickenpox or get a vaccination. And if you have enough of those IgG antibodies, they can help you be protected against the future infection for a long time, like decades or years at least. What we don't know with this new coronavirus, because it's a new virus, we don't know the timing of the IgM and IgG antibodies, how long they last, and we don't know whether IgG antibodies, simply by the current tests, which are limited, and they're for the most part qualitative. They're just give you a yes or no answer. Do you have antibodies or not? They don't quantify the level of antibodies you have. And so therefore, we don't know whether these tests indicate that someone has enough antibodies to protect them against a future infection or to protect them from being able to transmit the virus if they're infected again. So we just honestly don't have the answers to these questions, and the tests that are available right now today aren't capable of giving us the answers. At least, well, many of the tests that are available haven't been studied by the FDA, and many of them look for either total antibody or just IgM antibody, and those aren't as useful as looking at IgG antibodies. And again, they're not quantitative. So we don't know, just because someone has a positive antibody test, we don't know if that's actually protective against a future infection.
Thank you.
So just to go a little bit further, we don't think right now that based on the tests that are available, that those results should be used to give anybody an immunity passport or say that you can go back to work or you shouldn't go back to work, because we just don't know enough about what those results actually mean.
Thank you. I'm wondering, again, knowing that there are so many unknowns, but hypothetical best practices for after-school classes, camps, once things really do open up, as these organizations think about drafting potential policies, potential scenarios for what it looks like for them to open up. We've talked about, perhaps requiring cloth masks, maybe increase sanitation, disinfection practices, limiting participants. Are there other, and again, knowing that these aren't official recommendations, but could you help us brainstorm some of the other practices that organizations might start considering?
Yeah, I think one is hand hygiene is so important because we will continue to touch things, even if everybody's wearing a mask. It's still important to wash your hands often and try not to touch your face. So a lot of places don't have hand hygiene stations, sinks with soap and running water. So to the extent that those can be added to some of your facilities, that's going to be a good thing to protect against COVID-19 as well as foodborne illnesses and norovirus and all kinds of things. An okay second option, if you can't install a sink with soap and running water, is hand sanitizer, alcohol-based hand sanitizer. It's less effective against some viruses, but it's If you don't have soap and water available, it's definitely better than nothing. So thinking about things like that, how can you provide those things in your spaces would be a good thing for you to be doing now.
Picking up on that, talking about the supplies and hand sanitizer, we had some questions around new practices for libraries, galleries, other places for having access to cloth masks and hand sanitizers. And I think this question is about needing extra for visitors to spaces. So what's your opinion on trying to obtain the supply and demand issue of getting your hands on the cleaning items and hand sanitizers that these organizations are going to need to be well stocked with?
Yeah, the state may have some role in helping organizations get cloth masks. I'm not sure that long term it's going to be the state's responsibility, but if an organization is looking for either places to purchase their own masks or ideas of how to get them made at lower cost or things like that, you can reach out to the State Emergency Operations Center. And Amy, I can send you information about where folks can reach out. Not that they're going to provide you with a supply of masks necessarily. They might at this point. I'm honestly not sure. But I think they may at least be able to refer you to some good places where you can maybe source them yourselves.
That's great. I'll follow up with you on that. And this is where I should say too, our COVID-19 section of our webpage has, there's one page in particular for resources for organizations, and that's where the recording from this call will be. That's where we'll put any kind of follow-up information from this call, and that's where we'll be listing future conversations on this and other topics. And on the hand sanitizer front, there was a big run on hand sanitizer. Any, sorry, I know this is not maybe exactly in your wheelhouse, but what do we know about the accessibility of getting organizations getting gallons of hand sanitizer ready for when they reopen?
It's not in my wheelhouse, so I don't know, but I know that organizations are coming up with creative ways to make more of that. So some distilleries, I don't know about in Vermont, but I know elsewhere in the US and in other countries, distilleries are being revamped to create hand sanitizer. So I think, you know, the need is going to persist for a long time and the increased demand will persist for a long time, but the capacity is also increasing. So hopefully there won't be shortages.
And a question about recommendations around gloves. Should we wear them or not? If we do, should we sanitize them?
Yeah, gloves are tricky, right? Because you can wear, you can have gloves on, but if you're touching contaminated surfaces and then touching your face, it's just like not having gloves on. And they can give a false sense of protection. You know, people might think, oh, I'm wearing gloves, so I'm safer, but unless you're changing your behavior and what you're doing with your hands, you're not necessarily safer. And if you're, you know, touching stuff and then touching your face, the gloves haven't really done anything. You also need to be careful if you're wearing like rubber gloves, for example, and then if you're taking them off, there's, you know, there's certain ways to take off personal protective equipment like gloves or even a cloth mask so that you're not contaminating other things with the glove or the masks that you take off. So
in terms of personal behaviors, there's nothing like a Zoom meeting screen to make you realize how much you touch your face. That's my own personal check-in. I'm realizing I think we're all struggling with that.
Yeah, it's hard. It's really hard not to do.
Yeah. Great. And I am just scrolling through lots of really good questions, folks. And I think that we have covered most everything. A question about the cloth masks and the usage and should we be washing our cloth masks after every use?
Ideally, yeah. I mean, if you think about it, I was wearing one the other day because on Easter, actually, I went to visit my mom, who's in a high-risk group for many reasons. And so we sat outside her apartment and we were all wearing masks and, you know, sat 6 feet apart just to be able to visit. And realized when I got back in the car, I took my mask off. It was pretty moist just from breathing into it and talking into it. So yeah, ideally you'd have a supply and be able to wash them after each use. So any of you sewers out there, you know, I think we're going to need an awful lot of these cloth masks because just having one isn't really going to do it. Once you wear it, good idea to wash it.
And a question that I think is about our own, all of our individual messaging about this approach to flattening the curve. And we are starting to hear questions, and I think in some cases maybe donors or attendees at some of these performing arts centers are getting questions and wondering if Vermont isn't overreacting because, gosh, there aren't a whole lot of cases. But how do you respond to that? Help us respond to that very well as we get those questions.
Yeah, it's a valid question. And the reality is we've had over 800 Vermonters who have tested positive, many more than that who have been infected. And I forget, I should know our death count, but it's above 30 for sure of Vermonters we've lost already. And you know, the best estimates from epidemiologists across the US and in other countries, even in hard-hit areas, it looks like as of right now, around a third of the population has been infected if they do studies looking at antibodies or the PCR tests using nasal swabs. But in a lot of places, the majority of places, when they've done these studies, it's more like 10%. So that means that with the new virus that no one has immunity to, even in the hard-hit areas, right now only about a third of people have been exposed to it, and in most cases around 10%. So that means a whole lot of us are still not immune, and we may see this virus circulating and causing illness for months or years before it becomes more of you know, it may become like flu, like we know every season, every winter season in the Northern Hemisphere, it's flu season. I think it's going to be a while before we have enough Americans who have been exposed and are either immune or have gotten sick and recovered, that we're still going to see transmission for a while. The goal is to save as many lives as we can because we know who's most vulnerable, and also to lessen the impacts on the healthcare system so that we don't have everybody getting sick in the same couple month or short time period and overwhelming the healthcare system, and then not having enough ICU beds or ventilators, or not having enough healthcare workers to help people who are sick. So I hope that we've accomplished that, but as we ease up on the restrictions and as people get back to work and get out into society again, you know, I think we're going to see an increase in cases again, because the fact is the majority of us still are not immune. And, you know, if we open up too quickly, I think we'll just need to scale back in a tough way again, to decrease the impacts on the healthcare system and the most vulnerable.
Picking up on that, how would you say Vermont is doing in the availability of widespread testing?
Right now, there are no limitations on test capacity, and that goes to the kits that we need to collect the specimens, the reagents, and the lab staff and supplies we need to run the tests. There are not limitations right now. So anyone who has symptoms that could be due to COVID can be tested. We're not putting any restrictions on that. So we're in good shape with testing. we need to, the state EOC is focused on maintaining that capacity because, like I said, we're probably going to have cases at an elevated level for probably many more months. So we need to make sure we continue to have enough testing capacity. But right now, we're in good shape.
Great. And just want to throw out there, picking up on that, distilleries making hand sanitizers. Doreen's reminding me that Caledonia Spirits and Bar Hill has been one of those distilleries that's been making lots of hand sanitizer. So thanks for that, Doreen. And Gary's asking the best way to stay in touch. Oh, and Saxton's River Distillery, everybody's chiming in with their distilleries now. So we've got, it's clear, we've got Vermont distilleries taking up the charge of making hand sanitizer.
So
everybody's
awesome.
doing their part. I think I read something about a kombucha company too, you know, amping up the alcohol levels so that they could shift that kombucha making capacity into hand sanitizers. So in terms of updated information, just to reiterate, the governor's information conference is at 11 o'clock on Monday, Wednesday, Friday. The ACCD website, the Department of Health website have great up-to-date information. From the Arts Council side, we've got a COVID section of our webpage, and if you go to the main, I think it's all of our rotators on our main page point you to particular pieces of that, but there's a toolbar on the top right-hand side of our webpage. There is a COVID-19 resources for organizations page. That's where we will put the recording from this conversation, and that's where we will post information about ongoing future conversations. Also would encourage everyone to be sure you're signed up for our e-newsletter. That's where we will send out our regular updates for everything that's going on. And I'm seeing my partner, Christopher. Thank you, Christopher, for reminding us. We are, this is moving a little bit away from the public health to just make another announcement about cultural relief for organizations. As you may have heard, the CARES Act included funding to the National Endowment for the Arts and the National Endowment for the Humanities. And so the Vermont Arts Council is working with the Vermont Humanities Council. We will be unrolling a cultural relief grant program for organizations later this week. So again, that COVID-19 organization website and our e-newsletter, similarly the Vermont Humanities Council website and their e-newsletter are the best places to stay informed about that grant program that will be opening later this week. And while I'm at it, I'll go ahead and let you know that our rapid response artist relief grant that's already distributed $64,000 to artists. We are reopening that program on Wednesday with more funding to support artists and urgent needs based on loss of income in this crisis. So I am just scrolling through. I think we've covered a lot of ground here. Dr. Kelso, you have generously offered to have some future conversations with us. You or someone from your department in coming weeks, perhaps in 2 weeks or so, as things continue to change, and hopefully we learn a little bit more about what the future may hold. And I'm happy at the Arts Council, we can consolidate and send questions on to the Department of Health. Of course, anyone's welcome to reach out to folks individually, but we're happy to be a clearinghouse for these questions and to get them to the emergency management and public health folks. So feel free to reach out to me directly if I can help with any particular questions, and I'll send that on to the appropriate folks at the state. Oh, here's one last question. I think the answer is going to be we don't know yet, but I'll try it anyway. given the likelihood of the reemergence, as you described, Dr. Kelso, and the inability to time these fluctuations, does any scheduling of large scale, as in 100+ people, events make any sense in the next 18 months?
Oh, 18 months is going a long way out. Amy, I think you're right. The answer is we don't know, but I'm hopeful that we will be gathering again and going back to school within 18 months from now. Unfortunately, what it looks like in the more near term is really impossible to say, but at some point we'll have to get back to normal. Normal may be a little bit different. Hopefully people will wash their hands more and touch their face less, me included. But yeah, I mean, things will be changing, and I'm hopeful that we'll have slow incremental changes, maybe even week to week, or a couple times a month, and start getting back to normal sooner than later. But I think normal may just be a little bit different.
Well, Dr. Kelso, thank you so much for your time, and thank you for all you're doing for the state of Vermont to keep us safe and healthy. My very best wishes to everybody out there on this chat. To be continued. Stay safe, and thanks everyone for joining us. All right.
Hopefully I can answer more questions in a couple weeks.
It's helpful just to hear an expert say, we don't know.
There's a lot we don't.
We appreciate your time very much.
Thanks, everybody. Good luck.
Thanks,
Stay well.
everyone.